Good afternoon, welcome back. I'm Marcus Peter. Coming to you from the Good News Cruise 2026, we are talking with my dear friend Andrew Kubick, Senior Research Fellow for Public Policy at the Catholic Healthcare Leadership Alliance. He's also ethics consultant at the National Catholic Bioethics Center. We're having him to talk with us right now because the state of Virginia is moving forward on an assisted suicide bill, becoming one amongst 13 states to do so. Andrew, my friend, thank you very much for joining us. How are you?
Hi, I'm doing really well. How are you doing, Marcus?
I'm very well, thank you. Thank you so much for making the time. I know how busy you are.
Oh, it's my pleasure. Yeah, no, thank you. And thank you for having me on to discuss such an important topic.
I want to begin with the medical aid in dying is the euphemism that the legal sphere has coined. Can you please speak to the need for this kind of whitewashing euphemism and how heinous it actually is?
Oh, absolutely. It's one of those things that we see with so many of these moral evils that the people who are proponents of them try to manipulate the language so that it's more digestible, something that people are more willing to accept. And when we think about physician-assisted suicide, it started with that, precisely that name, because it required a physician, and now it would be someone with a medical license who has the authority to prescribe medicines, to prescribe a lethal dose of a toxic chemical for a patient to self-administer. By its very definition, it's physician-assisted suicide. But then it went from there to a physician-assisted death, because they wanted to get rid of that term suicide, because rightly so, as a general public, we all agree that we ought to intervene if we know someone who's wanting to harm themselves or take their own life. Every state, for example, has protocols to hold people, even against their will, just so they could be assessed to make sure that they're no longer a threat to themselves or someone else. Suicide has unanimously been agreed upon as a bad thing for the community, and yet they have to change that to get away from that unanimous consent. And so they went to physician-assisted death. But then they wanted to remove the physician from it, and they went to medical aid in dying. And then just aid in dying, because they didn't even want to put a negative spin on medicine and what it could do. And now they just call it death with dignity. A very, very, very misunderstanding, manipulation, perversion of what dignity truly means.
When you look at particularly the state of Virginia, it's very clear that its pre-existing state codes have numerous injunctions in place to stop the potential of assisted suicide, physician-assisted suicide. So these bills now are fighting against that natural instinct that you've just talked about.
That's correct, yes. So we have seen this before, and through the grace of God, these bills have not left committee. These bills have been squashed in committee because there were so many people, both believers as well as disability rights groups. I think those are the two strongest groups to stand up and oppose these type of bills. We have been loud and very clear every time a bill like this comes up. I think, unfortunately, though, we have the conditions in Virginia where we ought to be very concerned, and I would say start to pray, fast, and advocate now, because we have a governor who was just sworn in, who not only said that she would sign a bill that permitted physician-assisted suicide, but she even raised questions about whether healthcare professionals ought to be able to conscientiously object from cooperating in that. We have a lieutenant governor who was one of two senators, state senators, who wrote a physician-assisted suicide bill in the state Senate. And all 5 House delegates were reelected. Those 5 delegates wrote the House version of this bill.
In precisely this scenario, it becomes abundantly clear that what they're trying to push for is the fighting of this collective social sentiment, a recognition that this is an evil, and it's an attempt to rewrite the social narrative, not just the law.
And you know what? Sadly, Marcus, there seems to be, and I pray this isn't the case, but there seems to be pretty broad support for this too. And I think it really comes down to not truly understanding what people are saying whenever they're surveyed, what they're saying they're actually supportive of. So I don't put stock into any one survey, but Gallup usually does a pretty good job. And they did a survey not just a year ago where they found that 7 out of 10 Americans, so 7 out of 10 respondents, thought that physician-assisted suicide should be legal. And what was really startling was they found 44% of Catholics surveyed thought that it would be morally permissible or morally acceptable. Now, granted, that number changes when you go from people who just identify as Catholic to weekly churchgoers, but still, there seems to be, if this Gallup poll's correct from last year, pretty broad support for this.
You take a look at the proposals of the bills to include provisions that the death certificate won't identify either suicide or physician-assisted suicide as the cause of death. Going back to exactly what you said about the Gallup poll, it's becoming abundantly clear that the public sentiment about the dignity of human life is waning.
I think so. I think that when I don't know to what extent I don't know to what extent I would say that the dignity or the respect for it, but I think that there's a misunderstanding. I think there's a misunderstanding in our culture today about the meaning and really the redemptive value of suffering. And so when we lose sight of the fact that, first off, no one in their right mind wants to ever see a loved one or friend or neighbor suffer. But the extent to which we respond to that suffering truly matters. And rather than provide the means for someone to take their own life and really ultimately reject the gift which is their life given to them from God, we ought to authentically accompany people so that we can raise in them the realization that their suffering can be placed at the foot of the cross and can be the means of redemption, not only for themselves, but even for their loved ones and even for people they've never met.
This whole thing has proven to be tremendously heartbreaking. And if we were to switch to just the policy level conversation, the Constitution doesn't actually allow for a federal or state constitutions don't actually allow for a right to assisted suicide. This is a real squirreling of the issue in general because, like you've said, we've lost sight of the dignity and redemptive meaning behind suffering and what that can do both spiritually but also in terms of social formation.
Unfortunately, all too often legislators and judicial branches are not afraid to create aspects into, in this case, state constitutions that not only were never there, but actually run contrary to that which does exist. We saw this 50 years ago with Roe v. Wade, when there was the creation of a supposed right to take the life of one's child in her womb. And now we're seeing this manipulation again today when it comes to physician-assisted suicide, where not only we're going to permit someone to take their own life and not intervene, but we're going to provide the means for it. And those means are going to be provided by the very people who swore an oath to heal and to never harm.
Now, in the face of especially bills that are being pushed forth like this, and as you mentioned earlier, doctors, medical professionals who have sworn oaths that it's clear that they either have no desire to uphold it in these regards or don't even have a concept of it. What can the average populace do to make sure that our voices are heard in terms of making sure legislations like this don't gain traction in our states?
Sure. Well, I think first and foremost, we run to the love letter of God, or we run to sacred scripture, and we see that some evils can only be driven out by way of prayer and fasting. And I think that is incredibly important. I think number two, I would recommend any of your listeners, if they find themselves in a state, as you mentioned, one of 13, that's questioning whether or not this is going to be legally permitted in their own state, I recommend looking into their own Catholic conference. So in Virginia, we have the Virginia Catholic Conference, and they provide a lot of material to help.
My friend, thank you very, very much for weighing in. Your wisdom and insight in this matter is crucial, and I'm very grateful.
Well, thank you, Marcus. It's always good to talk with you.
My guest has been Dr. Andrew Kubick, Senior Research Fellow for Public Policy at the Catholic Healthcare Leadership Alliance. We've been talking about Virginia politicians trying to push forth bills for physician-assisted suicide.